Watchman family of devices are the Watchman device, which has been FDA approved since 2015, and the Watchman Flex, which has recently been approved. And you can see the fundamental difference between the two. You can see on the left side, the Watchman device has got open ends, which can actually be traumatic, whereas the Watchman Flex is shorter in length and rounded and closed, which makes it less traumatic. This device has got certain advantages that the device actually can be recaptured completely and reused at the same time without any trauma. So therefore, it's a safer device than its previous generation. This is the data that we have from the Watchman Flex. These are the characteristics of the Watchman Flex device. If you look at its center, the first thing, it has greater number of struts. So you have more contact points, so better sealing. It has dual rows of anchors, increasing the stability. It has the ability to be fully recaptured and repositioned. It has reduced metal exposure, decreasing the thrombus rate. This is the data which supported the approval of the study. Dr. Sheffield and myself were the co-primary investigators of the clinical trial that led to the FDA approval. The subject study was 400 patients in 29 sites. It was a single-arm study, and each patient had a device improvement, and after they had to be on DOACs for 45 days, and aspirin, and then after 45 days, DOACs was stopped, and they started on aspirin and clopidogrel, and then aspirin after 6 months indefinitely. The primary safety endpoint was all-cause mortality, stroke, and systemic embolization, or any device or procedure-related events that was major in the first 7 days. Tell them to get ready. Yeah. And the primary effectiveness endpoint was a closure of the left atrial appendage, a less than 5 millimeter gap. This is the demographics. These were an older group of patients, which average age was 74. The CHAS-VAS score was 4.2. If you look at the actual implant success rate, there was actually 398 cases out of 400. So the success rate was 99%. And this is definitely slightly better than the previous studies where the success rate is slightly lower. If you look at the implant successes, you can see most of the devices, the commonest device was used was a 27 millimeter device, but 10% of cases were actually a 35 millimeter device. So you can see that the Watchman Flex has a larger device up to 35 millimeters. So it's got a wide range. So you can close an appendage from almost 12 to 33. This is the primary safety and efficacy endpoint. So the performance of the primary safety was that we made a performance score based on our previous data of 4.2%. That was 2.7% plus a delta, which made it to 4.2%. And the upper bound of the confidence interval should not have exceeded the 4.2%. And you can see here the event rate was 0.5, and the upper bound was actually 1.5%. So the complication rate was very low, and therefore it was clearly superior or at least non-inferior to the previous generation of devices. If you look at the event rates, there was no death, there was no systemic elevation, there was no pericardial effusions, there was no device embolization. There was only 2 patients who had ischemic events post-procedure, both of which recovered. This is the comparison of the Watchman Flex in safety compared to the previous generations of devices. What you can see is the average complication rate in 7 days ranges somewhere between 1.5 to 2.2%. In the last national registry was 2.2%, but the complication rate with the Flex was only 0.5%. Clearly telling you that this is clearly safer than the previous studies. When it comes to effectiveness endpoint, which means an anatomical closure with a gap less than 5 millimeters, the performance score was set at 97%, and we achieved 100% of patients who had a gap less than 5 millimeters. So this also met the endpoint of non-inferiority. So if you look at it over here more carefully, most patients had a complete closure. Only 10% have had a small gap. This is clearly better than the previous studies where they actually showed that it's about 33% gap. These are the other adjudicated events. There were a few pericardial effusions, but none within the first 7 days, a few within 45 days, and one at 1 year, which was related to an AFib ablation. There was no device embolization through the entire study period. This is the device-related thrombus. There were actually 7 patients who had device-related thrombus at different time points. Most of them were around 45 days. A couple of them were seen at 1 year. And only 2 of these patients actually had events from the DRT. And these are the pericardial effusions, as I told you, none of them between the first 7 days, a few late, and one late, very late at 1 year. So the conclusion is the Watchmen family of LA occlusions is the most well-studied LA occlusion device. The Watchmen Flex will replace the Watchmen device in the United States and around the world. There's a rapid expansion of this therapy, and the trial resulted definitely proved the superior safety and efficacy of the next generation Watchmen Flex device. Thank you very much.